Hello, everybody. My name is Paitra Modlin. I'm a physical therapist with Carolina's Rehabilitation in Mount Holly, and I'm really excited to be here with you today as part of the 2020 Myrtle Beach virtual MoveIt walk. I'd like to talk with you just a little bit about exercise and staying active. We do know the benefits of exercise and staying active for physical and emotional well being. These benefits have been well researched in the general population and more specifically in people with Parkinson's disease. So, people with Parkinson's disease who exercise show benefits in their muscle strength, in their walking, their balance, their posture, their flexibility and range of motion. People who exercise can show improvement in endurance or their stamina for daily activities. Can even see benefits or improvement in your ability to move from one position to another or transition. For example, like standing up from a chair, getting in and out of bed, rolling over, even getting up from the floor. And people who exercise regularly report just an overall sense of well being, emotional well being. They often experience less depression and anxiety, just a general improvement in the quality of life. And then, if we're able to participate in any classes or group exercises, there are the additional social benefits as well. These classes give us opportunities to get out and to a social setting, get out in the community, and see our exercise buddies, and that's always fun. In addition to all of those benefits, did you know that exercise can help the brain to maintain old connections, to form new connections, and to restore lost connections? And this might slow down the progression of Parkinson's disease symptoms. So, people with Parkinson's disease lose dopamine producing cells in the brain. And dopamine is a neurotransmitter that helps us to have coordinated, controlled movements. And exercise allows the existing dopamine cells, the remaining dopamine cells in the brain, to work more efficiently. In other words, your brain is able to do more with less. So that's another benefit of exercise. And so there's an expression that we like: exercise is a medicine, so you should take it every day. It's important to know, too, that there are exercise possibilities for you regardless of your ability level. So exercises can be done in sitting, standing, even lying down, and it's all good. You're going to benefit. Exercise is good no matter what. There are some different types of exercise. Now, there are exercise programs that have been developed specifically for people with Parkinson's disease. Maybe you've participated in some of these with your physical therapist or maybe even in some community classes. These programs tend to target problem areas that are common to people with Parkinson's disease. The specific exercises work to increase the scope and the force of your movements, increase the range of motion of your movement, to strengthen your postural muscles that help to hold you up tall, and they help you to move from one position to another more efficiently and help to improve your walking and your balance, among other things. So these are common problem areas among people with Parkinson's, and the exercises are designed specifically to target those common problem areas. So the first one I'll talk about is LSVT big or big exercises. Maybe you've heard of these. This is a very specific and a very standardized exercise program that targets the size of your movement. Often with Parkinson's disease, movements begin to shrink. You may notice that you're taking smaller steps. Maybe you have smaller fine motor or hand movements, smaller reaches with your arms. Maybe you don't swing your arms as much when you walk. The big exercise program focuses on finding the largest range of whole body movement that's safe and efficient for you, so that you begin to recognize those bigger movements as normal and you begin to use them in your everyday living. It sort of helps to recalibrate your brain, help you to recognize that those small movements aren't normal, even though they might feel normal to you now. But when you start doing the big exercises, you begin to recognize that the bigger movements are what's more normal. These exercises are done with a lot of effort and intensity, and they're usually done with a physical or occupational therapist 4 times a week for 4 weeks, with a home exercise program that's done while you're in therapy and after discharge from therapy. Another type of exercise that was designed specifically for people who have Parkinson's is called power moves or Parkinson's wellness recovery. Um, Power exercises uses 4 basic moves in a variety of positions. For example, sitting, standing, on your belly or your back, or on all fours. And these moves or these positions serve as building blocks for everyday movements like standing up from a chair, rolling over, getting in and out of bed, walking. And like the big exercises, the power moves are done with a lot of effort and intensity, and they become progressively more challenging as you improve. And of course, there's always a home program. You can learn power exercises with the therapist, and there are also some power fitness classes with trained fitness instructors in the community. So, to find the best exercise program for you, work with your therapist and work with a therapist who has experience working with people who have Parkinson's disease. Maybe you can look for someone who is LSVT Big certified or certified in Power Moves. You can always ask that question, or there are websites that tell you therapists in your area who are trained in those 2 programs. Boxing is another wonderful activity for people with Parkinson's. Boxing, like the other exercise programs, targets many areas where people with Parkinson's disease might need work. Areas like weight shift, balance, trunk rotation, big arm movement, strength, upright posture. Rock Steady Boxing gyms are located around the world, and they're specifically offered for people with Parkinson's disease. They offer a boxing-based fitness program, and they also offer exercise programs for all fitness levels. You can check the Rock Steady Boxing website for a location near you. All exercise is good, but how you exercise matters. So these programs, the LSVT Big exercises, the Power Moves, the Rock Steady Boxing program, they encourage you to push yourself, to exercise beyond a level that you would select on your own. And they encourage you to exercise with your very best effort for the most benefit. And remember, they can be adapted for any fitness level or any stage of Parkinson's disease. Now, in addition to these, there are mind-body exercises that are wonderful for challenging our brains and our bodies at the same time. Yoga, dance, and Tai Chi are all forms of mind-body exercise. These types of exercise require some mental focus and sustained concentration. And many areas offer yoga for Parkinson's or dance for Parkinson's classes. You would just have to check your area. And again, your physical therapist can be a wonderful resource to find these sorts of community classes. Tai Chi, and you probably know this, but it's an ancient Chinese form of movement that today is practiced as a graceful form of exercise. It involves a series of movements that are slow, focused, and controlled and coordinated with deep breathing. And Tai Chi classes are not specifically designed necessarily for people with Parkinson's disease, but just the very nature of Tai Chi offers a lot of benefit for people with Parkinson's. There's some wonderful research on Tai Chi and Parkinson's disease, and it almost consistently shows improved balance and a reduction in your fall risk with regular participation in Tai Chi. Sometimes you can find Tai Chi classes at local churches, community centers, maybe the YMCA, and it's another form of exercise that can be done seated, standing, or even standing with support for balance. There's so many ways to exercise or stay active, so in addition to any home program that you've established with your physical therapist, choose some activities or forms of exercise that you enjoy, and you'll be more likely to continue them. Maybe you enjoy walking, hiking, bowling, cycling, swimming, strength training. Mix it up a little. Try some different types of exercise or activities so that you don't get bored. And with any exercise or activity, safety is the number one priority. So you want to be careful with what you do so that you don't fall or have an injury. So we've talked about the importance of exercising and staying active and different ways to do that, but maybe we should spend a few minutes talking about our current situation. At this time, we find ourselves in the middle of a pandemic. So, maintaining an active lifestyle with regular exercise is a challenge in ordinary circumstances, but the recent COVID-19 pandemic presents us with extraordinary challenges. Suddenly, we're told to stay home to protect our health, maybe particularly if you have underlying health conditions. Our routines are disrupted. Our group exercise classes may be postponed or canceled. If you were participating in physical therapy, maybe those sessions are on hold for now. Our social interactions are limited. You may be experiencing increased feelings of depression or anxiety, which in turn limits motivation for exercise and staying active. The first thing I would say is just be kind to yourself. We're all trying to figure this out. We're all trying to figure out how to exercise and stay active in safe ways in the middle of a pandemic. So if you aren't very successful one day or you didn't do all that you thought you could do one day, you can get up and try again the next day. It's not too late. A couple of thoughts on staying active and continuing to exercise during this crazy time. I would encourage you to continue any exercise program that you've established with your physical therapist. So you want to maybe even talk with your doctor to see if a referral to physical therapy is indicated at this time. Maybe you need a tune-up. Some therapy clinics are offering telehealth sessions or virtual sessions if you're not comfortable venturing back into the clinic setting and if your insurance covers this service. And remember, you don't need any special exercise equipment for your home. Simple body weight exercises like sit to stand are very effective for improving your strength and mobility. And you want to move through your full body range of motion every day so that you can maintain that flexibility, maintain that motion. You want to use it so you don't lose it. And when you're exercising, try to choose exercises that encourage and strengthen the muscles that lift you up against gravity, that help you to stand and sit tall. Those exercises are preferable to exercises that pull you forward into a more bent or a flexed posture. Gravity and time are pulling us all forward. We need work on those muscles that work against that to help us sit and stand tall against gravity. And if you get tired quickly, you can exercise in smaller bouts. Smaller blocks of time. For example, if you aren't able to walk for 30 minutes, you could do 3 10-minute walks a day. Gradually try to build up to gain more stamina for longer walks. And again, choose activities or types of exercise that you enjoy and get outside if possible. We all need to get out of the house and enjoy some fresh air and some sunshine whenever possible. I've also noticed that there's some wonderful Zoom classes or YouTube classes if you're particularly savvy with the computer. And there are YouTube classes that are specifically for people with Parkinson's disease. Just remember to be safe. Hold to a chair or a sturdy object if your balance is impaired. You might also consider a buddy challenge. Contact a friend or a family member and challenge each other to exercise every day. This kind of helps to motivate us, hold us accountable. A little healthy competition is a good thing. So check in and encourage each other. Check in with and encourage each other regularly. I know my family has done this, and this has helped us to stay motivated to exercise during this pandemic. No matter what, I know you're going to be successful with your exercise and your active lifestyle journey because you are awesome. Thank you so much for letting me join you today, and I wish you all the best. Take care.